Hi, if you're here, it's because you're looking for the recap video on the last quarterly meeting, and we'll get there in just a second. But I did want to talk a little bit about how these quarterly meetings have been changing a lot in the last couple of years. So back in 2016, the first quarterly meetings were fully in person, and then the pandemic shifted everything and we went fully virtual. Right now, we are in that sweet spot where we're able to do hybrid and tap into those both elements. The problem is that people are getting a little bit too comfortable just tuning in, and our in-person attendees are dwindling. And that really does strip away from what the original intent of these quarterly meetings was. It's turning more into a webinar than a collaborative space. We want to make sure that the in-person element is still alive and living and breathing, so that we're able to be that one space where local professionals in San Diego are able to collaborate and convene in these spaces and talk about a subtopic within human trafficking and tackle it from multiple angles, different perspectives that typically our audience does embody. And unfortunately, technology has not caught up to that in-person element that really does help us build relationships and brainstorm and throw ideas around in a much better and natural way. And we're really missing out on that. So I want to highly encourage you all to attend in person if you're able to for the next meeting. Our next speaker is going to be Dr. Leanna Rada, and she's going to be talking about her preliminary findings on sexual exploitation on college campuses here in San Diego and Imperial County. She was able to survey universities and community colleges across the county and had some very interesting and unfortunate numbers pop up. And we'd love to be able to have your perspective and on where how the problem is originating, and then also what we can do as a community to ameliorate this. Thank you. Dr. Arduizur Carli Richie-Zavaleta is our research fellow here at H2 Radar with Point Loma Nazarene's Center for Justice and Reconciliation, quite a mouthful. She is also a mentor for online MPH graduate students at the University of New England. And she graduated with a doctorate in public health with an emphasis on community health and prevention at Drexel University. She also earned a master's in arts, Masters of Arts in Sociology at the University of Peace, and her diverse background and the different focuses that she's had really does prepare her to have a more holistic approach on these sorts of topics. So we're really lucky to have her here today. And Dr. Sarbinaz Bekmuratova, which actually is a really good friend of Dr. Carli, great colleague. I've seen them work together, and it's really a beautiful thing to see two great minds come together and just interact. She is currently the assistant professor in the Department of Occupational Therapy at Creighton University, and she is the chair-elect for Human Rights Forum and co-chair for the Women's Caucus at the American Public Health Association. She is passionate about social justice, human rights, and has been working with marginalized populations throughout her life. She graduated with a doctorate in health services research and administration and policy from the University of Nebraska, their medical center. And both of these women have a vast number of publications on different topics revolving public health and sex trafficking itself as well. So without further ado, I will ask Dr. Carli to come up here and for Dr. Sarbinaz Bekmuratova to unmute. All right.
Thank you, Luz. Thank you to that Center of Justice and Reconciliation for having me here and be able to present some of our work. Like Luz mentioned, I'm a colleague of Dr. Sarbinaz Bekmuratova, and we've been working together for several years now in this topic. And so it's always an exciting moment to share our work. And so thank you for joining and Thank you for being here, physically here in this room. So what I'm going to be presenting, or we both are going to be presenting, is actually 4 separate studies we have conducted, 3 of which have been published, and 1 is in the process of being published. So I'm going to begin with some framework notions or ideas to really think about your practice and where you fit in that framework. And then I also going to share with you some of our work that we did about last year, where we came up with, based on the literature, based on the practices that you guys are doing, based on what we have studied and seen and survivors information and input, we came up with 6 guiding principles that we believe are useful in any practice or any anti-trafficking effort. So that's kind of the beginning of this presentation. Then Dr. Bekmuratova is going to share with you guys some of the work that we have done with occupational therapy graduate students and how that developed to a second study and more of a educational training components. And then I'll end up sharing with you guys what we did with public health graduate students, kind of just as examples of how this framework could work, and these 7 core principles could be applied in practice, whatever you do in the anti-trafficking movement. So thank you again for having us here. I'd like to begin with just the purpose of my research is really to inform practice as a public health professional and researcher. When we think about community approaches to solving a social issue, right, we want them to be evidence-based approaches, because that's going to give us better results. So again, when I do research, really my purpose is to inform practice. Another reason why we do research is to narrow the existing gaps that exist, especially within the human trafficking literature. And of course, the long-term goal is to really help prevent and help survivors of human trafficking to have the best support possible. So just in all this work, different projects, we have utilized the definition of human trafficking that we can find in our law, in the US law. And it sounds like all of you guys are familiar with this definition of what it means to be a human trafficking victim. So the first idea that I would like to share with you guys is to think about, so within public health, when we think about prevention, we have a framework, it's called the Public Health Prevention Framework, and it pretty much focuses, you can divide prevention into 3 categories. One will be the one that's the primary one, the one that is trying to keep people from actually becoming ill or preventing that harm. The second one is once that harm is done in the community at the individual base, then that's the secondary prevention, to identify it. And then the third one is to address the illness or disease or social issue. So that would be the tertiary approach to prevention. And so we thought about well, before I said that, like I can provide some examples. So again, at the primary prevention phase, you really try to keep people from injury or diseases, right? So that would be maybe some cancer screening. That would be an example of primary prevention, just trying to cut it right at the beginning or before it happens. So risk reduction, we vaccinate, we try to encourage people with good, healthy habits. On the secondary, once maybe that individual start to get those symptoms, is to kind of identify it at the very beginning, so then we can do something about it. So that would be a mammograph or some, routine yearly work, blood work. So that would be an example of a secondary prevention. And then on the tertiary is, again, addressing that illness. And so you may have to go through chemotherapy or physical rehabilitation of some sort to mitigate and then hopefully get to the other ends. So when we thought about this framework, we thought about it and then apply it to the anti-trafficking efforts. So when we think about, also we thought about, okay, when you think about the stages of trafficking, right? We have this kind of also plays out in the primary, secondary, and tertiary when we think about the grooming period, the exploitation, and then that rehabilitation. So it kind of, you easily can overlap this framework when you think about your own work, your own research, or your own efforts at any level. So keep that in mind as we, after the presentations, we want to provide you a space to think about these frameworks and this information, and just think of where you will fit in this framework. So, for example, we have, this is actually a book chapter that we wrote last year. And we thought about, and we went into the literature, and we really tried to figure out and come up with examples that had been, both that had applied this framework and also that have applied at least some of these core guiding principles that we offer in this chapter. So at the beginning, at the primary prevention, we identify one of a few youth, there's not that many, there's a couple more, but we identify the No More program, which is run also by the center. And this very creative drama-based program seeks to prevent the trafficking of youth in our schools. So that's a very local, San Diego local program, and it's based on a change, kind of like social change theory, which again that's important component, and it's an evidence-based. There was survivor input in that curriculum creation. So this program, it was solid as an example of primary prevention efforts in our cities. For the secondary one, again, the secondary prevention piece is when you are trying to, there's already people who have been recruited and they're being exploited. So in the second piece, in the second level of prevention, we're trying to identify those victims, whether it's in their business, whether it's at the clinics, whether it's at hospitals, or even like in airports. So there were a couple of, in that chapter, we describe a couple of different examples, but one of them that seems very creative was the tattoo parlors, and this work is being based in Nebraska, where they would started to see tattoo business owners that they would bring. There was something going on in terms of the types of tattoos that women were getting. So they partner and they collaborated, and so now it sounds like they have formed a coalition, and they get trained, and it's a partnership with other agencies that is happening in Nebraska. Another one that it seems pretty strong, solid, has been there for 30 years is a program called End Child Prostitution in Asia Tourism, and they started training flight attendants, and now that they have a chapter, they have established themselves in the US as well. And what they do is like they train businesses to identify potential victims. And again, this is the secondary prevention. And the tertiary prevention, we found this model is called Safe Shelter Collaborative. And maybe some of you are familiar with it because it's one of the chapters is here in California, but it's a model that has been implemented and is being expanded all throughout the country. And it's a model where agencies try to find safe housing once someone has been removed from the trafficking situation, and then trying to find housing, a safer space, and then the rehabilitation piece. So very quickly, this 7 core principles, some of you guys probably already take into consideration in your practice, but we found that the evaluation piece and then the sustainability and the multidisciplinary collaborations many times are missing in our practices. And those are really important to continue to develop the literature that will then help us understand what is effective. We want to be able to invest and be effective in our efforts. So we believe these 7 core principles, guiding principles in practice are important, and that would give us better results. So I will leave this to, I will pass the time to Dr. Bekmuratova, where she's going to explain again a couple of the areas that we feel we need to strengthen the training of this. When we think about multidisciplinary collaborations, there's really very limited work that has expanded beyond social work, medicine, law enforcement. We really want to bring public health, OTs, pharmacists, businesses, and other disciplines into these efforts. So again, these are just a couple of examples of how we have begun to establish some literature, some understanding of what the interests of these other disciplines are.
All right. Thank you, everyone, for having me here. I'm very excited. I am very grateful for Center for Justice and Reconciliation to let me share some of the work that we've done together with Dr. Richie-Zavaleta. So for the next portion of the presentation, we will be focusing on the areas of human trafficking research right now that's hasn't been well researched, but the important areas. So like Carli mentioned, given the complexity of the issue of multi-layered and complex issue of human trafficking, it's very important as a society to bring more and more people, not only in the healthcare, but in all other industries, to join the movement so that we can tackle this issue, right? But there are still a lot of professionals who haven't yet really actively joined the trafficking. So one of them is occupational therapy. So first, I am going to, so given that gap, we decided to and address it with a study initially to assess the doctor of occupational therapists' awareness, knowledge, and self-efficacy about human trafficking, and also evaluate their desire for future. So what we did is we did a cross-sectional online survey. We initially, sorry, did you say something? Okay, so we initially did send out to a total of 232 students, and the survey included 30 items, and we included both quantitative and qualitative elements into it. So the study participants were students who were enrolled in a hybrid doctor of occupational therapy program here at Creighton, in Nebraska. So here's the demographics. So a total of 67 students completed the survey, and so majority of the students were between the ages of 23 and 27. They identified as a majority identified as non-Hispanic white. There were some Asian in the sample, and also those who identified as other races. Majority were females, US citizens, and there's also a breakdown of the years that they were enrolled in the program. And also the states. So there were students from Nebraska, Colorado, Alaska, and Minnesota represented. So the very first domain that we looked at in the study was awareness of human trafficking amongst OT students. So these are the items that we included. So as you can see, majority could identify that human trafficking is a problem in their society, problem in the United States, that it happens outside the US, or that it doesn't only happens outside the US, but it also takes place in their state, as well as they ever heard of human trafficking. And the next domain was on the knowledge of human trafficking. So these are the items that we included. As you could see, the percentage are a little bit different here. First off, we asked them if they ever attended an informal event or received any formal training. So 48% said they attended an informal event, and 35% said they received formal training. We also asked them if they could, if they were able to identify the categories of human trafficking, labor and sex. 58% could identify, 65% could agree to that it's human trafficking is also perceived as prostitution. And 95% said no to the statement that US state citizens are not the victims of human trafficking. 63% reported that they know who's more likely to become a victim of human trafficking. 86% said that that women and youth are primary victims of human trafficking. And lastly, 86% said that victims of human trafficking voluntarily disclose their situation with healthcare providers, which is not the case. And the last domain we looked at in the quantitative portion was perceived self-efficacy among students in terms of their ability to assist survivors of human trafficking if they were to work with them in their future clinical practice. Here, as you can see, only 21% said that they know enough about human trafficking to help survivors, even though 71% said they are able to empathize with victims. 9% said that they are able to assess whether a person is a survivor of human trafficking, and 35% reported that they have an understanding of the different needs of survivors. And only 11% said that they had dealt with a patient survivor of human trafficking in their professional responsibilities. Next, here you see on your screen the qualitative results, and the qualitative piece focus mainly on their recommendations on how to incorporate, how they wish the human trafficking formal training would be incorporated into the academic curriculum. So the four themes emerged here. The first one was identification of human trafficking. So they really wanted to know how to identify, recognize the signs and symptoms of human trafficking to be able to, again, recognize that the secondary prevention that Dr. Richie-Zavaleta mentioned. And second theme was on safe intervention. Once they identify the victims, how they could safely intervene. So, and you guys could also see some of the quotes that we put just to have for you to have an idea what those, quotes are. And we definitely have more quotes if you look at our published study on this. Third theme was on the trauma-informed care. So once they knew how to identify and intervene, they also wanted to learn more or highlighted that it's very important to know how to provide trauma-informed care and resources for this population. And lastly, they also shared their recommendation on different modes of and incorporating human trafficking content into their curriculum. So some of them, there were different recommendations. So top one was the panel discussion with OT survivors and OTs. Some others were lectures, simulations on human trafficking. And additionally, they also wanted to have field work experiences where they can have actually life experience with survivors. So the main highlights of the study is that we found that the students had the awareness of human trafficking was high among them, but their specific knowledge and self-efficacy in terms of intervening and assisting victims was not that strong areas, but they were very open to receive specific human trafficking training to be well equipped in the future. So with that finding of like what students wanted to see in their academic training, and panel was one of the top areas or the modes or what they wanted to see. And so with that, we developed, so that informed the second study that I'm about to present. So we did organize a panel of human trafficking panel we invited two survivors of human trafficking who worked with OTs, and then two OTs who have worked with survivors. And so with this, our purpose was to evaluate the impact of that panel, short-term impact of that panel on the two areas that we saw that students were not strong, knowledge and self-efficacy. So we used the pre-test, post-test design, and for that we used the online survey where students had to complete it pre and post. Survey included 29 questions. Again, we included both qualitative and quantitative questions and demographic questions as well. So 80 students attended the panel and also completed the survey. So here on your screen, you see the quantitative results. I hope you guys can see it. So we included 25 items on quantitative portion of the survey, and out of 25, we found statistically significant change and improvement on 20 items that are listed here. And so this items mainly included things like they knew how to identify victims of human trafficking. They knew what clinical settings OTs could work with this population. The referral that they were also familiar after the panel, they were more familiar with different health needs of the survivors. Some other items were that they could develop treatment plan to address the needs of human trafficking survivors in terms of like ADLs, IADLs, meaningful leisure, work, and social withdrawal, things like that. And lastly, we also, panelists also talked a lot about, the OTs on the panel talked about the establishing trust, building rapport, and using trauma-informed care. And so those items are at the bottom of this table where student knowledge and self-efficacy significantly increased in those areas as well. And next is for the qualitative portion, we asked 3 different questions. The first one, we wanted to know what aspect of human trafficking panel they found most beneficial. So 4 themes emerged in here. So students really liked the first voice of panelists, of survivors and OTs. They really appreciated how the subject matter experts shared their stories. So they can hear it from actual people who experienced that traumatic experience. Second theme was on the impact of OTs on healing journey of survivors. They also found it very beneficial that survivors really talked specifically how OTs really helped them in their healing journey. The next theme was on survivors' interaction with healthcare professionals. So the survivors on the panel, they really talked about before they started working with OTs that they have interacted with different healthcare providers and they were misdiagnosed throughout their journey. And so this was the part that was highlighted by a lot of students as well, how it was very informative for them. And lastly, the resources. So panelists also provided resources to the students who attended. And so students also found that as a very informative part of the panel. Next, we ask how students are planning to apply the knowledge they obtained from the panel in their future clinical practice. So here, 4 themes again emerged. First one was empowerment of survivors, giving power to survivors. So they really acknowledged the fact that in OT, especially field, OTs are very trained to ask a lot of questions, to fill out the, their forms and stuff. But here they really understood that they can't really do that with this population, that they have to be patient and let the survivor decide at what pace they want to share and when they want, if they want to share their story. The second one, I was using trauma-informed care. So they really also understand how applying trauma-informed care with this population or any population that's similar to this population should be really important for them to use trauma-informed care. And the third theme was an application of soft skills. So a lot of students talked about different soft skills. So most of them, they mentioned that they will work on building rapport, establishing trust. So more like applying listening skills and not to be judgmental, and let them, again, survivors to share at their own pace. And the last theme was using different OT interventions. So panelists, the OTs in the panel especially shared what kind of OT interventions they used with their when they work with survivors. So some of them, like here in the quote, you can see relaxation techniques or self-affirmation. They also talked a lot about arts and crafts and vision boards. And so students really felt like those are the things that it was helpful, and they will definitely take it to their practice in the future. And lastly, we asked them what, after that panel, still what is missing and what they want more, learn more about the intersection of OT and human trafficking. So the first area, the first theme emerged in this was they really wanted to know the referral process of human trafficking survivors, especially in various OT settings, healthcare settings. So the panelists on the OTs on the panel, they only obviously shared how they got the referral in the setting they were in, but given the wide range of OTs, like the settings that they could work in, they wanted to know like how that happens in other healthcare settings as well. The second theme was on interprofessional team collaboration. So students definitely did understood that given the complexity and wide range of healthcare needs of survivors, it will take a village, and it's best to, approach the or meet their needs and with the multidisciplinary team, collaborate with them, but they also wanted to know with who other OTs are collaborating and how that collaboration happens, where, and what their specific role could be in that. And the next one is they definitely, again, recommended that human trafficking content should be part of the OT curriculum, become OT part of the OT curriculum. So here in this example that we included, they talked about the mock session between an OT and the survivor. They really wanted to see this applied hands-on kind of examples instead of kind of read it or know it theoretically, but they wanted to know more. And again, here in this, they also highlighted having a fieldwork experience being provided to them. So yeah, that is it on my part. Thank you for listening. I'll hand it over to you, Carli.
Yeah, thanks. So as you can see, we've been working on these ideas for a long time. The idea of multidisciplinary collaboration, the idea of really training, other fields. And the exciting part is that actually graduate students are, maybe not all of them, but there's a good amount of graduate students, not just at Creighton, but at other institutions that really want to invest in learning about this topic, really having the tools that they need to go out in the field and support this specific population. So again, we did something similar with public health students. So I'm going to briefly share this. I'm sorry that it's cutting off on the top, but it's the Exploratory. This is the title of our publication, but pretty much we looked at same ideas, assessing the knowledge, self-efficacy, and what do they want? Awareness, knowledge, self-efficacy, and what do they want to learn, and in which modality would they want to learn these things for public health? So that was the aims of this study, very similar to the OT, but again with public health graduate students. And so interestingly enough, if you guys remember some of what Dr. Bekmuratova shared at the beginning, there's a really high awareness level in terms of human trafficking. And actually we've seen that even with high schoolers and middle schoolers, they have a high awareness, like very general knowledge, like idea of what it is. There's an issue here. But when it came to more specific, like in terms of like a specific knowledge of the issue, that's where they were weak. And they also, as public health is very diverse as a field. You can do prevention, you can do intervention, you can do rehabilitation, you can work in multiple different levels policy. There were some gaps in terms of a specific knowledge of human trafficking, interventions, laws, and how to identify vulnerable populations. So therefore makes sense that there's going to be a low sense of self-efficacy when it comes to helping others as a student. So again, some of the interesting piece was that some of the public health graduate students that were the sample on this study, which it's also I'll give you a little bit background. So these students are from Northeast University of New England, but because it's an online study, online program, they come from different parts, pretty much from all parts of the US and some abroad. And we have a more, many times graduate students for public health, they already is kind of like their second degree. So many of them are nurses, practicing nurses. So some of the nurses or some of the participants had some training in the past, and maybe they were a little bit more confident to identify some red flags. But overall, as a whole group, their self-efficacy level was low. And so most of them, they really want to learn about strategies and interventions and just different ways in which they can apply their their major into helping the anti-trafficking movements. This is, again, we also had some qualitative components to the study. For example, one is a student or one participant, graduate student, in terms of intervention and resources, he said, or she said, we need a working understanding of what interventions will be useful in aiding survivors. Provide students with knowledge of resources to guide them, to guide the survivors to necessary offices and to help them get that information or that resource. And then the other component of the qualitative focus on best practices, again, to identify, to communicate and care. Very similar to the OT students, different, they want to learn different techniques to work with this population, making them self and trusting. And again, it's kind of like a trauma informed and better in that training regarding psychological and physical traumas related to human trafficking. And then the last construct that we were able to identify in the qualitative piece of the study was understanding human trafficking through a public health lens, which again, very similar to the OT from their own perspective, just thinking about how public health then intersects in whether it's prevention, intervention, or rehabilitation. So to me, that's exciting as a public health researcher and professional to really try to focus then now in developing training within our public health schools to have a workforce that is trained to then go out and collaborate with all of you guys. Now, in terms of modality, this study had, we identified 4 types of modalities within the study. So some people say, I want this to be part of my current courses. Some say I want to be an elective. I want it to be more of research career opportunities. Maybe I was thinking maybe like a certificate of some sort. Or this person said, I would like to learn about current and future human trafficking research that a public health graduate could assist with as projects or postgraduate career opportunities. And then workshops. I think that's a learning modality that students like these days, right? Like really hands-on ways of learning something. So there could be, one person said, there could be a voluntary workshop held by professionals to train MPH students on recognizing human trafficking and helping survivors. So I think the question, so when we look at these different fields, that really there's not a lot of, even though public health has recognized human trafficking, when you look at all the programs throughout the country, back a couple of years ago, I couldn't find one that had a human trafficking certification, a human trafficking elective, a human trafficking anything. And I think we are in a place where in the anti-trafficking movements that we need to focus on the prevention, but also thinking about how do we build more efficacy within the future workforces of different disciplines. So these are some suggestions, like what are the next steps, right? Thinking about this prevention module that public health allows us to implement in the anti-trafficking movement, we can then be more specific and more and target the areas, especially of prevention and rehabilitation. The US government has been pushing for the training of law enforcement, social workers, the medical fields, especially MDs and nursing, in the nursing field. But there's so many other things that other fields that could come along, especially when we think about the rehabilitation piece. As an OT, they have all the tools needed to really help those women come to a place of healing and reintegration back into society, because they can provide case management, they can provide resources, they can provide all kinds of techniques that would help women and any survivor overcome their trauma. So when we think about different fields, we have different strengths within each field. And so if we can't train the future workforce, then we'll have a better, more sustainable anti-human trafficking efforts. And we really need to focus more on the prevention and the rehabilitation piece. Now, the core guiding principles, and I didn't spend too much time defining those, but if there's questions, I can answer those. But when we think about sustainability, we want to, unfortunately, in the last year, I have heard of just 2 programs that had to end because they were not maybe supported. There were too many challenges, and it's sad because they were focusing on helping. One of them was helping youth who had experiences, and they were focused on the rehabilitation piece, and then they could not sustain their program. So that really is discouraging. But I really feel that if we can have these principles and we can apply them, and although it's not easy, I understand it's not easy, but I think coming together and even talking about it, that could be a first step to really think about how can we create programs and efforts in a more sustainable way? How can we increment our multi-discipline collaboration? And again, this is coming from a public health person, but having robust evaluations that help us to really know and evaluate. There's no one perfect evaluation, of course, but to create the most possible robust evaluations so we know what areas work and what areas we need to change and modify to serve better our populations, whether we're doing prevention, intervention, or rehabilitation. And I just want to say, like, the compassionate care, I think we are very aware of victim-centered or survivor-centered approaches and trauma-informed, but I believe that sort of compassionate care approach is one that goes the extra mile. It's not just understanding, like trauma informed, we're aware of the trauma and we try to connect with that person, we build that rapport, but compassionate care approach, it goes that extra mile, it goes that extra step to really support that person that needs it. So thank you very much for your time. Thank you that you have shared with us this time. I just want to acknowledge all the participants in all these different studies for their participation, and just a special thanks to the research assistants that help us and the interns that have helped us, and even putting together this presentation. Our intern, Valerie, helped us. So if you, here's our contact information. Let me see, is there something else after this? I think not. But it's 11:30. Yeah, okay. So if there are questions that we can answer before we moved into our different groups, we can do that now, and then we'll go into groups. And
this is in person on this first, but
do you want to come up here so people can hear?
So just wondering what I'll ask the question. Of all the different professions out there, I know that you and Dr. Bekmuratova have focused on OT and public health. What do you think is the next field where people should be focusing research on? And they haven't just yet. Like, if you could pick one of all the professions, which one would it be? Thank you.
So definitely, I think one that is also emerging in this, trying to build their workforce is pharmacists. There's a lot of victims that come to the pharmacy pharmacy settings, and they ask all kinds of questions, and they always come in for something because they're constantly being hurt or they need something. So pharmacist is one, and I know there's been some work, but it's kind of at the very beginning. Definitely when we think about prevention that would be more like intervention, right? Like victims or survivors coming, they're still on that trafficking place. Definitely teachers for that prevention piece. More training, more education. That I know that's kind of starting, but it's still kind of in the very baby stages or very green stages. And then on the rehabilitation piece, I think over and over, like we just finished, we're trying to publish this and we're so close. And there's a study. We looked at 5 years of this assessment tool that collected data, and one of the things in that rehabilitation piece was legal assistance and job training. So like businesses, I think that if we can have businesses really understanding, right, like human trafficking complexities, if we can have more attorneys really being invested in assisting survivors to really reintegrate and make that full like circle of not just the psychological and emotional, but also the other things that we need to, live a life, especially in expensive cities like San Diego or anywhere in California. So those would be some of my suggestions.
Any other questions?
I could quickly add to that. So I agree with the pharmacy one, because I think when we look at the healthcare providers are joining the anti-trafficking movement, because there's the evidence that victims, while they're in captivity, they do go see a healthcare provider, right? But evidence also shows that those who even don't go to a healthcare provider at the clinic or anywhere, they still go to a pharmacy when they have a need. So I think pharmacists really, joining and being able to recognize the signs and symptoms and being able to intervene is definitely an important step. And I think outside of healthcare, we need to bring in more industries. Industries could be like where the recruitment usually happens with young kids, for example, like in the malls, right? So it could be the store, the people who work at the store, so they can pick up all those signs and symptoms. I think as a society, when we move forward, we need to think outside of box when it comes to bringing people to the table and also developing new interventions. And also keeping in mind, again, all those three levels of prevention. And because currently the most efforts are focused on the secondary prevention, training people to recognize the signs and symptoms. However, we shouldn't be forgetting about the primary prevention, like, working with at-risk youth and things like that, educating the general public, and as well as the rehabilitation piece.
I don't know. Are there any? Yeah, I think that's good.
All right, we will now be shifting to the breakout groups. So for those of you in person, if you don't mind coming together, that way we can discuss and share ideas. And then online, we will be launching. There are a series of questions that we're gonna ask. So Laura Decker is actually going to post that into the chat if she hasn't already. And then we will be reminding everybody as the time progresses. That way, you all know what to focus on or what to shift your questions. And in person, of course, we'll be doing that as well. You are able to join as you please, but I think this is one of the best parts of HT Radar, the fact that you are able to network with other people. 2 minds, 3 minds, 4 minds are better than one. And really just being able to collaborate and come together in these spaces is one of the great things I think that San Diego has been spearheading. So we want to continue to do it, even if it has to be online. All right, so you should be seeing on your screen now the option to join a room. I do have one last announcement, so I'm just going to make sure that everybody's made it back. Have the breakout rooms closed completely? Okay, all right. So one of our newest developments as of yesterday, HT Radar launched a filterable website where you can see the webinars. We previously had them all listed out, but now you are able to filter if you're looking for healthcare and labor trafficking. You hit filter and you get a whole list of resources. And this includes webinars and trainings from different organizations, all very reputable. And that way we're maximizing the resources that the whole field is putting out, and you'll be able to find things more easily. I do want to give a shout out to Narissa, who is here in person. Narissa Lane is our HT Radar intern, and she's put in a lot of work making sure, making sure she's been able to tag all of these and just maximizing that accessibility for you all. We're hoping to do this throughout the rest of the HT Radar website. That way everything is much more navigable and accessible for everyone. But we will be doing it in stages, but this is the first one. We are still adding. You'll see that we do have about 100 webinars that are tagged at the moment, and each month, if you're subscribed to our newsletters, you're receiving a little bit of what's come out in the last month of those webinars, and we'll be adding those here as well. So it will be a living, breathing resource for everybody, and yes, I'm very, very happy and excited about it. And aside from Narissa, we did have another intern whose name is Kyla Kinsley. She had been doing a lot of the legwork as well, but not inputting it necessarily in the website. So yes, I hope that you all had some really great productive discussion. I got to hear in on the in-person discussions, and aside from some great brainstorming, got to hear some great anecdotes of collaboration that's already happening, and that's always very inspiring to hear. So thank you all very much. We will be posting the recording of this soon. You will be receiving it in the email, and I'll double check with the presenters and make sure that we can send you the slides as well. But yes, feel free to explore the HT Radar website if you haven't already. There's lots of great things, and yes, you'll be hearing from us soon. Thank you very much for joining us. It's always a pleasure, and feel free to email me if there's anything that I can help you with.